Hello and welcome. My name is Juliet Huang, and I'm a community pediatrician here in Southern California. And I'm also a frontline healthcare worker, like many of you out there during this COVID-19 pandemic. And I'm realizing how important it is that we as healthcare providers really take care of ourselves during these times, these stressful times of crises um, that we have encountered, we are encountering, and will encounter. Um, so I've decided to set up a series of these short videos that you can watch at your own time when you feel like you have some space or some capacity in your heart. And this first video will be about just a small introduction to mindfulness. What is mindfulness? Why are people talking about it? How is it helpful? Um, just to give you a little introduction of myself, I've been practicing for over 16 years um, in the tradition of the International Plum Village Sangha under our dear teacher Thich Nhat Hanh. And I first started when I was a medical student, and it has helped me come back to myself, take care of my suffering, and really transform it and share my experiences with other people. And I'll start with the definition of mindfulness because it changes depending on who you talk to. And so I'll start with Dr. John Kabat-Zinn. He's a PhD and a scientist who started the whole wave of research into mindfulness in the 1970s with the mindfulness-based stress reduction course. And he says mindfulness is awareness that arises through paying attention on purpose in the present moment, non-judgmentally. So it's really just paying attention in the present moment, non-judgmentally. And for me, that non-judgmental part is really the hardest part because as a healthcare provider, we are constantly taught to judge, to think, is this person sick? Is this person okay? And so it kind of goes against our whole training, our whole background. So it's really hard to kind of sometimes stop and come out of that habit. Another scientist, Dr. Dan Siegel, is a child psychiatrist actually at UCLA, and he talks about the three components of mindfulness. He talks about focused attention with intention. Number two, he talks about an open awareness, this capacity and spaciousness to hold and non-identifying with things that arise, whether they be strong emotions or things that we see. And then he also talks about kind attention, which is just an aspect of compassion and love to ourselves and to others. I'm also going to bring in Tara Brock. She's also a PhD clinical psychologist and beloved meditation teacher from the East Coast. And she says mindfulness is a way of paying attention moment to moment to what's happening within and around us without judgment. So she also brings in this capacity to hold what's going on inside and around us. Now the researchers, when they talk about mindfulness, if you read a lot of mindfulness papers, they talk about the three major components, which is attentional control, self-awareness, and emotional regulation. Why people really love mindfulness is it gives us the capacity to regulate ourselves so that we don't fly off the handlebar really quickly, so that we don't react quickly, but we can actually just stop, slow down, see what's going on inside. And when we're calm, that's when we can access all our faculties. We can make a clear decision about what is the best thing in the moment. And as healthcare providers, that is something that we really want to encourage and really want to nurture during the times that we can. And we can't do this without self-awareness, without being aware of what's going on inside ourselves and other people. And when we talk about mindfulness, these are qualities that we already have, that we are already nurturing, that we've been practicing our whole lives. Unfortunately, with the rush of everyday modern life, sometimes we forget about these things. But These are all things that I'm sure a lot of you already do in your everyday lives, in either an intentional practice with yoga or prayer, if you have already a sitting formal meditation practice, or when you're taking a walk in nature, or you're sitting there being present with your child or with your pet. And these are things that we already have. Now, my teacher, Thich Nhat Hanh, he talks about when we do practice meditation, the Buddhist meditation, and he talks about really the mindfulness practice in many, many ways, not just a sitting formal meditation, but in the way we walk, in the way we talk, in the way we breathe, in the way we move. He says it is in the practice of meditation that we generate 3 kinds of energy. It's mindfulness, concentration, and insight. So when we're mindful, we're just aware of what's arising in the present moment. And then with concentration, we increase that energy so that we can maintain our concentration on our focus of attention, whatever that may be, whether it's the breath or our bodily sensations or things going around us. But it is the insight that is what captures my heart. When we're calm and we're connected with ourselves, there is insight that blooms. And it is from that insight, my teacher says, that can liberate us from our anger, our fear, our anxiety, and our despair. And from that insight, we can figure out what is the best plan of action. What is something that I can do? What is my fear trying to tell me? How is it trying to protect me? What is my anger trying to tell me? What kind of boundaries have been crossed? What is my anxiety trying to tell me? And I think it's during these moments that if we can stop and slow down and come back to these sensations, to these emotions, as difficult as they may be, they will bring a lot of insight and really transformation. This practice is really the art of transformation. And ultimately, my teacher says, liberation from all this suffering. And so I encourage you, if you have any interest, to take this opportunity in the midst of this pandemic, in the midst of this crisis, to find time to come back to yourself, to nurture the happiness inside you, around you, take care of your body. Because my teacher says we have no control over the past, and we have no control over the future. The only control we have is in the present moment. So how awake, how aware, how fully open-hearted are you in this present moment? How open-hearted are you in the moments that you're interacting with your patients, with your clients? How open-hearted are you when you're interacting with your family members or your loved ones? And so if we can take each moment as an opportunity for openness, for learning, for love, for transformation, for insight, for liberation, we can use that energy to help others and hopefully to create this a new world, a liberated world, a revolutionary world with less suffering. Thank you so much for listening, and I hope it has been of some benefit. May you be happy. May you be peaceful. May you be free from injury and free from anxiety.